Hi, hello, welcome back from break. This is chapter 18, Nutrition for Pregnancy and Breastfeeding. This is the nearly the end of the book. We just have a little bit of life cycle nutrition to finish up. So this chapter, it looks like a lot of slides, but there's not that much that you need to be concerned about the detail. So let me try to point out important things. So the first section is nutrition and fertility. So the questions are how does fat and how different nutrients affect um, fertility. So the main thing here is just to know that there is a problem with a lot of couples are having trouble getting pregnant, and some of it can be related to nutrients. So it's important getting the main macronutrients, but also antioxidants are really important in the ovulation cycle and for spermatogenesis, as well as B vitamins, zinc, and iron. So the main two vitamins not vi- the main vitamin and mineral for men causing infertility is folate and zinc. It's important that males get plenty of these nutrients so that they can form sperm correctly. Antioxidants I mentioned are really important. Those are found, as we know from other chapters, in these particular vitamins and minerals. And also the body fat level is important. If you have too little fat or too much fat, it can lead to amenorrhea for females, which of course will decline in birth rate. Um, you need to have a BMI of at least 20 to even have a period for females. And then also for men, if they're too little fat, it can lower the sperm count. Too much fat is the same effect. It can interfere with conception if your BMI is over 30. So just being a normal weight is very helpful. The second section is on just prenatal growth and development. So once you are pregnant, we're going to look into how does the baby grow, like how much each month. First of all, the normal pregnancy is divided by trimesters. There's 3 trimesters. Um, and the first trimester is the formation of the fetus, a lot of details, organs, tissues are developing, and the third trimester is where most of the growth occurs, where the most weight is put on. So here for the first trimester is the first 13 or 14 weeks of pregnancy. This is a picture of the ultrasound of a 20-week-old baby. Very rapid increase in cell number. The baby, the size of the baby also, although it's still quite small, the first trimester, it does rapidly divide from 2 cells to many, many cells. This is the period of time you have to be careful not to be nutrition deficient or to be exposed to toxins, or certain medications that can interfere with the development of the baby, radiation, trauma. So this is really important to be in good health during this period of time. And then this here you can see the effects of teratogens or things that can cause biologic changes in your baby. So here, major structural abnormalities could occur in the CNS, the heart, the limbs, the eyes, ears, teeth during this first trimester. So it's an extremely important time to be careful. And then the third trimester is the most growth of the baby, where the baby actually doubles in length and triples or quadruples in weight. So a lot of this woman here is about almost through her third trimester. Iron is another. Minerals are particularly important in the last trimester because the baby is storing up iron after its birth at this point. So there needs to be plenty of iron in the mom so that she can donate or give some of it to the baby. A normal birth weight baby is 7 to 9 pounds, and that's what you would hope to see. This is for a successful pregnancy then. You want to make sure that you have all the nutrients that you need. So for instance, here's an example of some babies, some newborn, same baby at 6 months of age. You can see they put on a lot of weight, even the first 6 months. But an infant that's born at least at 37 weeks gestation, even though 40 is the average, is considered success. If they're greater than 5.5 pounds, and if they had lung development and no problems with development with undeveloped lungs, then that's considered a pretty good delivery. The other thing about about growth and development is that it's important that the mother, her BMI, before she becomes pregnant, it has a large impact on the outcome of the baby. So if the mom is underweight before she's pregnant or even overweight, it can affect the birth weight. So an obese woman then often has more complications during her pregnancy, more birth defects, higher likelihood of death early in life, the mother herself, and then more likely the child can become obese. If the mom is a low BMI under 19.8, then the infant is more likely to have a low birth weight, more infections, more learning disabilities, and less nutrient stores because they probably didn't get the iron during the third trimester that's important for them for full development. This this section goes into all the different minerals and vitamins that are important, especially even exercise during pregnancy to maintain good health. The next section talks about other nutrients. So for instance, these vitamins, there's quite an increase in the need for B vitamins, especially folate, B6, and then calcium and iron and iodide and zinc are the four main minerals that we try to focus on during pregnancy. Iodide has a big impact on the thyroid development, which has an impact on metabolism of the baby, also brain development. Zinc is just needed for general growth and development and prevents mental retardation, and calcium, of course, for the bones, and iron, as we already mentioned, for good oxygen levels for growth and development. So those are the main nutrients we try to focus on. If the mother doesn't gain their adequate amount of weight, 25 to 35 pounds during her pregnancy, that's if she's normal weight to begin with, there could be a problem for the baby. So these are just, this is just an graphic that shows the importance of the different nutrients. And then for her weight gain, just to know what she should gain, it depends again on her pre-pregnancy BMI. So if her BMI before she's pregnant is relatively good, between 19.8 and 25.9, then she should gain a total of 25 to 35 pounds, as we just mentioned. But if her BMI is less than 19.8, or in other words, she's underweight, she would gain up to 40 pounds. And if on the other hand, if her BMI is high, above the 26, then she might only gain 15 to 25 pounds, or even less if her BMI is 30. So they have this pattern of growth because you don't want to gain the same amount. It all depends what you were before you were pregnant and how much your weight gain should be. Here's again the importance of the iron we talked about. Often during pregnancy, women need a supplement. It's hard to get the RDA of 27 milligrams, normally 18 before pregnancy. If you're not consuming iron fortified foods or meats, red meats, you might need the supplements. Supplements are a problem though because they can cause GI problems, and so there's times you can take them that make the least interference. And the reason, of course, you're taking iron is to prevent anemia. Because the mother's blood volume increases a total of 150% above normal, there is a large need for iron because of all the red blood cells that are increased during pregnancy. So you can just see here that the umbilical cord, the placenta, is directly next to the baby and its blood needs. So this area here where the movement of blood is carrying all the nutrients, all the oxygen, and all the waste, is extremely important that there be enough blood flow, enough oxygen. And then other than that, there's more nutrient needs, and then we will get to the next section, which is different changes that happen physiologically just because of pregnancy. Now, certain things happen besides being more blood volume. There's also a relaxation from the progesterone, which is higher during pregnancy of muscle. So there's more heartburn and there's more gastrointestinal reflux type of feelings if you're not careful. So they often suggest smaller meals, less spicy foods, and then not lying down right after you eat. So that's a problem you might have. Another more serious problem would be gestational diabetes. So some women who are not diabetic when they become pregnant get diabetes during their pregnancy. Because it's so dangerous to have diabetes during pregnancy, every woman is screened at week 24 to 28 to make sure they don't have gestational diabetes. Women that have this are more likely to get full-blown type 1 diabetes or type 2 diabetes after they're pregnant. And you may need insulin during your pregnancy. It increases the weight of the baby. It might have lower or higher blood glucose levels, and it can cause more malformation. So it's really important that you try to maintain your weight, your exercise, your eating during pregnancy to prevent this from happening. Another really dangerous situation during pregnancy could be gestational hypertension. This is when you don't have hypertension before you become pregnant, but then because of the pregnancy, you can gain a high blood pressure. And this can be fatal to both the mother and the baby. Preeclampsia is pregnancy-induced hypertension, which is what you don't want to get. So gestational hypertension just means high blood pressure, but if it gets more dangerous, more aggravated, it could become what's called preeclampsia, and there's a little video about that. And then even worse is eclampsia, which can actually cause death of the mother from seizures and a large amount of protein in the urine, which is a sure sign that you have this preeclampsia, which is serious high blood pressure. So those are things that we're trying to prevent during pregnancy. After the baby is born, of course, this chapter also talks about the importance of breastfeeding. Because of the advantages of breastfeeding, the nutrients that are in the milk of breast milk, it's highly recommended that infants are breastfed, recommended for 6 months minimum if you could breastfeed without any formula. The World Health Organization recommends up to 2 years of breastfeeding. The American Academy of Pediatrics up to 1 year. It's been found that breast milk is almost like gold in the amount of nutrients and immunoglobulins, protein. The minerals are much more absorbed, better absorbed than in formula. So it's highly recommended. The first milk that comes out after you have your baby is called colostrum. They call it the superfood. It's yellow because it has beta carotene in it. It has tons of antibodies, lactobacillus. It provides protection from infections, and it helps move the bilirubin through the body of the baby so it doesn't get jaundice. So it's a really important part of the nursing. Later, the mature milk comes in, which is higher in fats and higher in protein, and that, of course, is the next milk and the final milk. Lastly, then, if we just look at the vitamins, then, if you are breastfeeding, babies often that are breastfed might need a vitamin K. Well, every baby usually gets a vitamin K shot at birth to help with blood clotting. Until they're 8 days old, they don't have the ability to clot blood. Vitamin D is needed for breastfed babies, or the mother can take vitamin D supplements. If you're a vegetarian, the mom needs B12. Iron would only be needed if the baby is low birth weight at birth, and fluoride also is not needed the first 6 months. So there's a couple things. The way that breastfeeding works is there's something called the letdown reflex. So there's two main hormones, oxytocin and prolactin, which have to do with the milk production. So the letdown reflex is that the milk is already made and formed and ready to be released, and that is triggered by what's called oxytocin. And that brings the milk from the milk ducts to the nipple where the baby can get a hold of it. The letdown reflex here is actually controlled by the nursing of the baby. So as the baby sucks and suckles, the brain is stimulated to produce oxytocin, which then lets the milk down, and it also produces prolactin. Prolactin tells your body to make more milk. So as the baby's nursing, your body is making milk for the next nursing. So by giving a bottle of formula instead of nursing, you are essentially beginning to wean your baby. So they suggest not using bottles for the first 6 months if possible, unless you're going back to work and have to, so that the baby can get established, the milk supply can get established. So those are some of the importance of breastfeeding. And the last section here is just preventing birth defects, some of the things we've already talked about. One of the things is alcohol. It's particularly important not to consume alcohol during pregnancy because of what's called fetal alcohol spectrum disorders. So by the baby getting a small amount of alcohol, which does cross the placenta into the bloodstream of the baby, then it causes multiple birth defects and cognitive disorders. So here is for every 1,000 live births, 0.5 babies are diagnosed with this particular, and it causes physical as well as cognitive changes in your body. So there's just a few things. You can look at the rest of them, a few more things that might be particularly dangerous during pregnancy, but to have a healthy pregnancy, this is important to follow this information. Okay, enjoy chapter 18.